am Dr. Sandeep Tiwari, Principal Faculty of Pharmacy, Kalinga University. Today I will deliver lecture on posology. After completion of this video, you will have brief idea about posology and different factors which affect the dose of a drug. So posology, this word is derived from Greek word that is posos, means how much, and logos means science. So posology is a branch of medical science which deals with dose and quantity of drugs which can be administered to a patient to get a desired action. So there are various factors which affect the dose of a drug, such as age, sex, body weight, route of administration, time of administration, environmental factors, emotional factors, presence of disease, accumulation, additive effects, synergism, antagonism, idiosyncrasy, tolerance, tachyphylaxis, and metabolic disturbances. So these are the various factors which affect the dose of a drug. One by one we will discuss. So first of all, we will discuss about how the age affect the dose of a drug. The pharmacokinetic of many drug changes with age, that is newborn infants are abnormally sensitive to certain drugs because of the immature state of their hepatic and renal function, by which drugs are inactivated and eliminated from the body. Failure to detoxify and eliminate drugs result in their accumulation in the tissues to a toxic level, whereas elderly patients are more sensitive to some drug effect, that is, for example, hypnotics, which may produce confusion state in them. Next, we'll discuss about how the sex affect the dose of a drug. Women do not always respond to the action of drug in the same manner as it done in men. Special care should be taken when the drugs are administered during menstruation, pregnancy, and lactation. The strong purgatives, such as, for example, aloes, should be avoided during menstruation. Similarly, the drug which may stimulate the uterine smooth muscle, for example, drastic purgative, anti-malarial drugs, ergot alkaloids, are contraindicated during pregnancy. Alcohol, barbiturates, narcotic drugs acts on fetus through placenta. So during lactation, morphine, tetracycline should be avoided because it affects on babies. Next, we'll discuss how the body weight affects the dose of a drug. The average dose is mentioned either in terms of mg per kg body weight, or another technique used as a total single for an adult weighing between 50 to 100 kg. However, the dose expressed in this fashion may not apply in the case of obese patient, children, and malnourished patient. It should be calculated according to body weight of the patient. Next, how the route of drug administration affect the dose of a drug. Intravenous doses of drugs are usually smaller than the oral doses. Intravenous route, this might enhance the chances of drug toxicity. The effectiveness of drug formation is generally controlled by the route of drug administration. Next, we'll discuss how the time of administration affect the dose of a drug. The presence of food in the stomach delays the absorption of the drug and rapidly absorbed from the empty stomach, but it doesn't mean that much effective when taken during or after meal. Iron, arsenic, and cod liver oil should be given after meal, and antacid drug should be taken before meal. Next, we'll discuss about how the environmental factors affect the dose of a drug. So the personality and behavior of a physician may influence the effect of drug, especially the drugs which are intended for use in psychosomatic disorders. The females are more emotional than male and require less dose of certain drug. Inert dose forms called placebos, which resemble the actual medicament in the physical properties, are known to produce therapeutic benefit in diseases like angina pectoris and bronchial asthma. Next, we'll discuss about how the presence of disease affect the dose of a drug. Drugs like barbiturates and chlorpromazine may produce usually prolonged effect in patients having liver cirrhosis, whereas streptomycin produce toxic effect on this patient. Their kidney function is not working properly because streptomycin excreted through kidney only. Next, we'll discuss about accumulation. So some drugs produces the toxic effect if it is repeatedly administered for a long time. For example, digitalis, emetin, heavy metals, because these drugs excreted very slowly, and this occurs due to accumulative effect of the drug. Next, we'll discuss about how the additive effect affect the dose of a drug when two or more drugs administered together is equivalent to sum of their individual pharmacological action. The phenomenon is called as additive effect. So, for example, when ephedrine is given along with aminophylline in the treatment of bronchial asthma, the effective of ephedrine is increases when it given combinedly along with the aminophylline. Next is how the synergism affect the dose of a drug when a desired therapeutic result needed is difficult to achieve with the single drug at that time two or more drugs are used in the combination form for increasing their action. This phenomenon is called synergism. So now, for example, procaine is given with adrenaline combination, it increases the duration action of procaine. Next, how the antagonism affect the dose of a drug. When the action of one drug is opposed by the other drug on the same physiological system is known as drug antagonism. The use of antagonistic response to drug is valuable in the treatment of poisoning. For example, milk of magnesia is given in acid poisoning, whereas alkaline effect of milk of magnesia neutralizes the effect of acid poisoning. When adrenaline and acetylcholine are given together, they neutralize the effect of each other due to antagonism, because adrenaline is a vasoconstrictor and acetylcholine is a vasodilator. Next, we'll discuss about how the idiosyncrasy affect the dose of a drug. Idiosyncrasy is also called as allergy, an extraordinary response to a drug which is different from its characteristics pharmacological action is called as idiosyncrasy. Small quantity of aspirin may cause gastric hemorrhage. For such some person are very sensitive to penicillin and sulfonamides because they produce severe toxic effect, and in few cases they are very sensitive to penicillin, and that penicillin allergy may cause anaphylactic shock or life-threatening respiratory distress. So next we'll discuss how tolerance affect the dose of a drug. So when an unusually large dose of drug is required to elicit an effect ordinarily produced by normal therapeutic dose of drug, the phenomenon is called as drug tolerance. For example, smokers can tolerate nicotine, alcoholic can tolerate large quantity of alcohol. The drug tolerance is of two types: true tolerance, which is produced by oral and parenteral administration of the drug; pseudo tolerance, which is produced by only to the oral route of drug administration. So next is tachyphylaxis. When some drugs administered repeatedly at short intervals, the cell receptors get blocked up and pharmacological response to that drug decreased. The decreased response cannot be reversed by increasing the dose of the drug, and this phenomenon is called as tachyphylaxis or acute tolerance. Ephedrine given repeated dose at a short interval in the treatment of bronchial asthma may produce very less response due to tachyphylaxis. Last, metabolic disturbance. Changes in water electrolyte balance and acid-base balance, body temperature and other physiological factors may modify the effect of drug. Salicylate reduce the body temperature only in case of an individual has rise in body temperature. They have no antipyretic effect if the body temperature is normal. So this is all about how different factors affect the dose of a drug. Thank you.